So I have the absolute pleasure of kicking off our webinar. So thank you so much, everyone, for joining us this evening for another educational webinar here at Well Beyond Breast Cancer. So tonight we are talking all about sex after breast cancer, what no one told you but should have. A super important topic. And tonight's webinar is going to be given to you by Dr. Alex Hill, an incredible physical therapist who specializes in pelvic physical therapy as well as oncology. And we are extremely grateful to have this webinar sponsored by Good Clean Love. So before we jump into all of that fun content, I just want to introduce myself. I am Amanda. I am the founder and executive director of Well Beyond Breast Cancer. Well Beyond Breast Cancer is a 501c3 nonprofit, and we are one of the first that is exclusively dedicated to improving the quality of life of the breast cancer community by making breast cancer rehabilitation, so physical and occupational therapy, more accessible to you all. How we do this primarily is through our financial assistance program, where we provide those who are uninsured or underinsured or just dealing with financial hardship with free appointments of physical therapy or occupational therapy with these therapists who are specialized in breast cancer recovery, breast cancer rehabilitation, pelvic floor physical therapy, and lymphedema therapy across the nation. So we are working really hard just to make sure that you get the care that you truly deserve and need to live well beyond breast cancer. Another program that we have here are these free educational webinars where we bring you directly in the comfort of your home information about different cancer-related side effects to help you better manage those side effects, again, with the goal of helping you improve your quality of life. So that is who we are. I'll leave all of our contact information at the end so that you can know more about us or connect with me if you'd like to know more. So, little disclaimer that these educational webinars are for educational and informational purposes only. They are not to guide your medical treatment or what have you. So please speak to your care team for specifics about you. They're just really here to give you information, like I mentioned. So I have the extreme honor of introducing our sponsor, our exclusive sponsor for this webinar, Good Clean Love. And I just want to give a huge thank you to Good Clean Love because it is truly because of these partnerships that we are able to continue providing our programming, so our financial assistance program, as well as our educational webinars completely free to the community. And we wouldn't be able to do what it is that we do for you guys without them. So thank you so much to Good Clean Love. If you don't know who Good Clean Love is, they are an incredible women-founded B Corp certified company committed to revolutionizing intimate wellness with clean, science-backed solutions. And we are super thankful to have the founder on the call with us this evening, Wendy. So Wendy, I will kick it off to you so that you can share more about this amazing company that you started.
Well, what a nice, kind introduction. And I just want to say how grateful we are to be able to be of service to women with cancer. We run clinical trials trying to better understand how the vaginal microbiome is affected during cancer, prior to cancer diagnosis, and also during cancer treatment. We're the only we are alone in doing that research because we really believe that the microbiome is going to tell us things that we haven't been able to see before. So, and that said, working with so many practitioners who are frontline caregivers to women with cancer, I have heard over and over again just how compromised vaginal health becomes during this time, whether it's a breast cancer or a reproductive cancer. And so I've been asked over the years to develop products to help them support their patients. And that's what we've done at Good Clean Love. So there, I don't have to, nothing I'm saying here on this slide is surprising to any of you listening, but we know that cancer therapies, including radiation, But certainly many of the medications to reduce or remove estrogen from your system have really substantial side effects when it comes to vaginal health. So, not only do we have vaginal tissue dryness and loss of elasticity and epithelial thinning. I mean, all that means that there really isn't much there internally in your vaginal walls to protect you. So it's easy for both not being able to keep good healthy bacteria there, and also then consequently the growth of bad bacteria, which creates ongoing both discomfort, dryness, itching, odor, all the symptoms that all seem to be the same, but really many times have different bacteria attached to them. So anyway, I'm sorry for those of you that are experiencing that, because, I just want to say that although we spend billions of dollars trying to treat vaginal health ineffectively, what many people don't know is that the amount of productivity loss when you are sick with vaginal conditions is twice what we spend. So $40 billion. So, which is to say that when you're uncomfortable vaginally, that is literally what you are. So we, really want to help in whatever way we can. And so our biomatch formulations are what we have developed. And that's why our products actually work so well for so many people. And the biomatch works three ways. First, it doesn't disrupt. By being isoosmotic, the product doesn't disrupt the immune layer and the cellular layer. And secondly, because we don't disrupt, we're able to establish and maintain a healthy low pH over time. And just that alone, that's the largest single lever of maintaining good, healthy vaginal conditions, is having good lactobacilli be present and not having bad bacteria. And that's all driven by the pH. And then the last thing that our products do is that we support the growth of healthy, beneficial bacteria by adding a proprietary kind of lactic acid that has both D and L isomers that the healthiest bacteria need to survive. So every Good Clean Love product you use, whether it's a wash or a gel or wipes or whatever it is that you use, uses this basic biomatch formulation that we've patented. And so I just kind of touched on the products that make a big difference for women. We've done clinical trials, and we know that the combination of this wash, which we call Rebalance, we also have one called Balance, but they're essentially the same formulation. And that is really, really super helpful when you have vulvar skin issues, whether post radiation or because you haven't had the right bacteria there for a long time. Likewise, our moisturizing vaginal gel that we developed for cancer patients called Rehydrate really, really helps to sort of counteract the loss of estrogen that many women are dealing with. And basically what we're doing in all of this with the suppositories and the pain gel, which is the same gel that you might get from your physician, that's a lidocaine-based analgesic, except that ours are, again, all matched, are all formulated in biomatch formulations. So all we're doing in this protocol is basically biomimicry. And we're just trying to sort of reset your microbiome to what is like the healthiest conditions that women can have. So and we know it works. So that's why we want to sort of help here and let you know about it. And that's why the largest part of our medical network that we support are pelvic therapists, because we know how critical that is to recovery. So anyway, I probably talked too long. Thanks for being patient with me. But I appreciate being here and able to sponsor this important event.
Thank you so much, Wendy. Yeah, I've personally recommended so many of your products, like I mentioned before, to a lot of my breast cancer and gyn cancer patients, and a lot of them have seen significant improvements in a lot of what they're experiencing. So I can't thank you enough, and I thank you again for being here. Wendy will stick around for our Q&A section, so you will have the chance to ask her all of your questions about Good Clean Love products. But now I have the extreme honor of introducing Dr. Alex Hill. Like I mentioned before, she is a physical therapist as well as a certified lymphedema therapist who is dual board certified as a clinical specialist in women's health and oncology physical therapy. And we are super lucky to have her here tonight. Alex does a ton of education, not only for patients, but therapists as well. So definitely give her a follow on all her social media channels. It's linked there, Oncopelvic PT, because she truly does do a lot of education to just help the community better manage a lot of their side effects. So Alex, I will hand it over to you for this part of the presentation.
Thank you so much, Amanda. That was a really kind introduction, and I just appreciate you and what you're doing at Well Beyond Breast Cancer so much. And thank you, Wendy, for supporting this. And just like Amanda, so I've been a physical therapist for 11 years now, and I have always recommended your products. I've loved the growth of them, so I'm really excited to have you as our sponsor for this. And Amanda, just to be able to talk about sex. So I do want to, before we go to the first slide, just give a little reminder that we are talking about sex. And as the title said, but just be mindful of where you're watching it. We are going to have some pictures of some genitals of the pelvic floor. I do have a model of the pelvis that we can use if we need it, especially for the Q&A section. So just be mindful of where you're watching it, having headphones in, that kind of thing. But I'm really excited to be talking about this and for the Q&A as well. So let's kick it off. So first and foremost is, what does sex mean for you? And so I was really excited when Amanda approached me about giving a talk. And really, this is the talk that you should have had somewhere between diagnosis and treatment and after treatment. But a lot of you likely didn't. We know in the research, I know from a lot of the patients that I see, that sex isn't talked about enough at all. And so that's one of the goals of this webinar. And with, like Amanda said, I do a lot of education online, is we have to start talking about this. We have to start talking about our pleasure and sexual activity and intimacy and all these things that you should be enjoying anyway, and especially after breast cancer. You beat cancer, we have to enjoy it, right? And so one of the biggest myths we internalize is that sex has to look a certain way. And so from that first slide, I want you to really think about, what does sex mean to you? And maybe start to think a little bit about how we can reframe how you view sex and sexuality and sexual health, as you can see here, especially after breast cancer treatment. We really need to start redefining sex and sexuality on your terms after breast cancer. So as you can see on this slide, we talk about sex, but sex is so much more than, again, that kind of typical, what we say, P and V, or penis and vagina intercourse. It is sexuality. It's how you view and how you feel about sex and sexuality. It's these intimate moments that you have with your partner. And it's more than just intercourse. It can be, are you snuggling and holding hands? It's these little ways that we can still have intimacy beyond just what we think of when we think about sex. And even when we think about sex, as you can see at the bottom, it's any type of sexual activity. It's outer course, so that means nothing is penetrating, and it's just external stimulation. And we'll talk about some ways that we can start to incorporate that if you have sensitivity or pain with that. And then we do have intercourse as well. But again, I want you to come into this webinar a little open-minded. And if some of this makes you a little uncomfortable, that's a-okay. That's why we're here. That's why we're offering this webinar, like Amanda said, from the comfort of your home. So you can kind of sit with this uncomfortableness a little bit. And again, try to reclaim your sex and your intimacy. So we're going to be going through some of the primary treatments and what they do to sexual health. And as Amanda mentioned, I'm a pelvic health therapist. So we have the pelvis here, and we have all of these pelvic floor muscles. This right here is the urethra, and then the vaginal opening. And then in the back, we have the anal opening. And at the very top here, we have the clitoris. So again, we think about sex, we think about these sexual organs, we think about the vagina, about the genitals. But especially as we talk through these systemic treatments, and even some of the local treatments, we have to think outside the pelvis in different ways that treatment can impact your sexual play. So we do have just about 30 minutes with this talk. So I'm not going to be getting into a lot of the nitty-gritty details, but I want you to come out of this with kind of recognizing some of the things that you might be dealing with or maybe didn't recognize as something that could be impacting your sexual health and giving you some tools that you can use. So first, we have systemic treatments. So we have hormone therapy. As Wendy mentioned, this is one of the primary reasons that breast cancer survivors are going to have some type of sexual dysfunction. It drops those hormones or it doesn't allow them to act on cancer cells. So especially if you have a hormone positive cancer, this is going to be used. And so with that systemic treatment, we have side effects like fatigue and joint pain. So you can think if you're already feeling tired throughout the day, no matter how much you rest or what you do, that you're just trying to get through your day, sex and being intimate with your partner might be the last thing that you're thinking about. Joint pain, getting into different positions for sexual play might be really uncomfortable because of that joint pain. We know there's decreased arousal and desire and impaired orgasm. So you might have a harder time reaching orgasm. It might take longer to reach orgasm, or maybe not able to reach it at all. And a lot of people also experience kind of a muted orgasm, or that orgasm, kind of the volume is kind of turned down. It's a little flat. So it might not be as robust as it was before breast cancer treatment. And then we have menopause, and that can lead to something called genitourinary syndrome of menopause, or GSM for short, because we definitely need shorthand for a lot of things in healthcare. And so if we go to the next slide, these are some of the things that Wendy was actually talking about already. So we have that drop in estrogen, and what happens is the genital system and the urinary system are both impacted. So within the genitals, so especially in the uterus and the vagina, there can be dryness, there's burning, itching, irritation, and thinning, and just less elasticity of that vaginal and vulvar tissue. So on the left here with the healthy vagina and uterus, you can think of those tissues as being very flexible, like a very stretchy rubber band. But then after menopause, if you develop GSM, which the majority of people going through menopause will develop some symptoms of this, then that elasticity is a lot less. It's that rubber band isn't as stretchy. And so that can lead to some of these symptoms you can see here. With the urinary symptoms, you can have urgency and frequency, burning with urination, increased risk for UTIs, leakage, and waking up more often at night to pee. You might even notice more urgency or maybe even leakage with sexual activity as well. And then at the bottom here, this is really a result of, again, all of those constellation of symptoms where you can have pain with intercourse, you have less lubrication, decreased arousal, lower desire, and maybe even spotting after sex. The next systemic treatment is chemotherapy. And so with this, again, we see the fatigue. We have a lot of bladder and bowel issues, especially GI distress. So maybe you have a lot of frequent bowel movements. Maybe you have more leakage with stool or with your bladder. And for a lot of people, if you have incontinence or you're just not feeling great in your tummy or in your bladder because of that chemotherapy, again, that can limit you from feeling sexy and wanting to be intimate with your partner because you're worried that you might have an accident or you might need to stop in the middle of it. We again see the menopause and the GSM, and then that decreased arousal and desire as well. But I hope that you are starting to see now outside the pelvis all these other things that can potentially impact your participation with sexual play. And then for local treatments, so first with surgery, nearly all surgeries for breast cancer are going to involve some type of removal of lymph nodes. That's to check and see is there any cancer in those lymph nodes? And with the removal of lymph nodes, the more lymph nodes that are removed, that's going to increase the risk for lymphedema. And unfortunately, what we see in the research is for breast cancer survivors who do develop lymphedema, whether it be in the breast or in the arm or both those places, that does impact sexual activity. It impacts your body image, how you're able to move your arm, especially if there's a lot of swelling in that arm and you're not able to use it as well. And then if we go back to the surgery, so there are two, we'll say, big categories of breast cancer surgeries. There's a lot of surgeries that are available, but you can think of these as surgeries that remove breast tissue. That can be a lumpectomy or a mastectomy. And then we have the reconstructive surgeries where you're maybe getting a saline implant or maybe a flap, like you can see here in the bottom picture. And you have that scar tissue. Anytime there's a surgery, there's going to be scar tissue. And with that scar tissue, that can potentially lead to pain, limited range of motion. Again, think about what your sexual play looks like. If you have your arms up overhead a lot, or if you're on hands and knees and trying to support yourself with your arms, but you're having pain or limited range of motion or weakness in that upper extremity, that can limit how you participate with your partner. Scar tissue can cause issues. Again, we talked about the altered body image. And then I have menopause on here, not necessarily because of the breast cancer surgery itself on the breast, but for some people who are getting a hormone therapy and they're having a hysterectomy, then that's going to then lead to that menopause as well, and possibly the GSM symptoms. And then we finally have radiation therapy. So these are going to be those high energy x-rays that destroy those local cancer cells. However, we know that with radiation therapy, that's going to increase the risk of cancer-related fatigue. Again, fatigue that's going to significantly impact your libido, your arousal, your ability to fully participate and want to be with your partner. Radiation fibrosis is very common. This is kind of a hardening or thickening of the tissue, but that in and of itself can lead to issues like pain, maybe some nerve issues or post-mastectomy pain syndrome, decreased range of motion. And then radiation therapy can also contribute to lymphedema as well. So again, we're thinking way outside the pelvis and the upper body, but think about how much your sexual play involves your upper body. That decreased sensation or altered sensation, or maybe even pain at the breast or the chest tissue. If your breast or your nipple is an erogenous area for you, but now either through surgery, they've removed the nipple and the areola, if there is scar tissue in that area, if it's very painful, then those are things that we can address and work on to help you be able to enjoy those parts of your body again, with or without sexual play. So we have here the sexual cycle, and there's going to be two parts to this slide. So this is the first part here. So this is really how our bodies respond in a sexual cycle. The first part is desire. So that's the very first thing that we need, is just the desire and the want to be sexually active, whatever that looks like. And then we have the excitement phase. This is where physiologically we start to see that the heart rate increases, our blood pressure increases, the genitals start to get engorged, we start to have more of that natural lubrication, the body's getting excited, okay, with that nervous system's getting excited. And then we hit that plateau phase, and that's really where things start to equilibrize a little bit right before orgasm. But the plateau is that feeling of you're almost there, you're almost there, you're almost there. And then it gets to orgasm. Orgasm is going to be important on especially pelvic health side, because orgasm is a reflex. It's a kind of symphony and an orchestra of a lot of different things, including different reflexes. The pelvic floor muscles are rapidly and strongly contracting and relaxing. And we have this burst of physiologic function. And then we have a resolution. And so, Amanda, if you click to the next part, so this is where we see then the impact of the breast cancer treatment on all these different parts of the cycle. And so when we look at, again, outside the pelvis, it's more than just the penetrative portion. If there's any part of the sexual cycle that's impacted for you, then that's going to lead to difficulties with sexual activity. Typically, we see that desire is reduced after cancer treatment. Excitement is reduced, meaning it takes more stimulation or it takes longer to get up to that physiological need to get to the next step. We see that the plateau stage takes longer. So it's taking longer, it's taking more stimulation. You're thinking, oh my gosh, like I'm almost there. I'm so close, but it's not quite there. And then, like I mentioned before, the orgasm, we see that typically there's a reduced orgasm response as well, or maybe even some pain with orgasm. And with that pain as well, if you have pain at any parts of this, again, that's going to extend this, reduce your sexual function with this as well. So, this all to say between the physiologic function of the sexual cycle and those physical things that we talked about before, all of this comes into play along with up here, right? Going through cancer treatment and diagnosis and all the things that come with it takes its toll emotionally and mentally. And that in and of itself can also impact the sexual cycle as well. And so I know, especially I've seen Amanda post about this, like it's so important to address the physical side and the emotional and the mental side. We can't have one without the other. So if we go on to the next slide, what can we do about it, right? It's going to be so frustrating. And our doctors aren't talking about it. We're embarrassed, so we don't want to talk to the doctors about it. We're trying to find things on Reddit or social media, and it's hard to figure out what's true and false, what's safe to do, and what can we really do about it. So that's what we're going to go through for this next part of the talk. And so I love that Wendy actually kind of kicked us off, because it's something that we talk about first and foremost is that vaginal dryness and that atrophy. Atrophy is just that thinning of that vaginal tissue. And so this is one of the most common things that as pelvic health therapists, getting breast cancer survivors referred to us for sexual dysfunction, this is one of the primary things that we address. So there are medications that are that can be available. The goal of these medications is to help restore those hormone levels locally. So I'm going to bring out this is going to be the first genital part here. So again, watch your cameras here. So we have here the external genitals. We have the labia majora, we have the labia minora, and then we have right inside here, this is going to be the start of the vaginal opening. And the vagina itself is a flexible muscle tube. And so if you're using a vaginal estrogen, it's acting locally just right here and vaginally where you're inserting it. What they're finding in the research is using it locally doesn't increase the systemic levels of estrogen. They've also found that using vaginal estrogen does not increase the morbidity, mortality, or recurrence of breast cancer. So this is still a very hot topic. I always encourage people, always talk with your medical provider to see, is this something that could be helpful for you? It's always something to kind of weigh the pros and cons for. But I know a lot of people and oncologists and patients have started to move in the direction of recommending this, especially if your symptoms are very severe, or if you've tried moisturizers or other things and they're just not as helpful. So again, the vaginal estrogen can be very helpful because it's acting locally at those tissues to help kind of rebuild those tissues and plump them up. In the middle here, we have moisturizers. So I love the Good Clean Love moisturizers. You can use different oils like vitamin E oil, olive oil, Reverie, so it's a hyaluronic acid, and Replens has been really heavily studied as well. And with these moisturizers, think of these as moisturizer like you'd use chapstick for your lips or lotion on your hands, especially in the winter when they can get dry and kind of feel like they're burning a little bit. So this is to be used at least a couple times a week. And I'm going to bring my model out here again. You're just going to massage it right on the inside part of the vaginal opening to help with improving that moisture. If you have any sensitivity, if there's that decreased flexibility, that friction and dryness, the moisturizers are really helpful for this. it is recommended to use them for at least 12 weeks. But I have a lot of patients that they just continue using them after those 12 weeks anyway, just because it feels better for the tissues. And then we have lubricants, and those are, I like to say, those are used for play, whether solo or with a partner. And these will help with reducing friction, reducing dryness, and also preventing irritation and micro tears. So if you've ever had pain with that initial penetration and right at the opening, it almost feels like it's like a paper cut or that you have a little tear there, you probably do have a little micro tear that can happen because, again, remember that rubber band muscular tissue is not as flexible as it was before. And so, if it's not as flexible, it can have those little micro tears. And so, the lubricants are really helpful for play to help with reducing the risk of those, along with kind of the background stuff of the moisturizers and medications. These are some that I usually recommend for folks. There's water-based and silicone-based. Silicone-based lubricants will last a little bit longer, but the water-based ones, the Good Clean Love, Aloe Cadabra is more of an aloe-based one. Those are really good for people who maybe have a little bit more sensitivities, because there's going to be a little bit less reactive for the majority of people. But a lot of great options that are available out there. So some strategies for decreasing discomfort specifically. So we have here those external genitals that I showed you before. So we have the labia majora, minora, and then the vaginal opening. And then underneath that layer, you can go ahead to the next part. Yep. So then we have those superficial pelvic floor muscles. So you can see here on the screen or on the slide, this muscle right here has a fancy long name, your bulbocavernosus. I always think it sounds like a spell or something. But this is the muscle that actually makes up the vaginal opening. And so you can think about this muscle as almost like the gatekeeper to the pelvic floor. And so if you've had a lot of stress, if you've had trauma to the pelvic floor, especially if that could be something like from menopause, those tissues are more dry, you're irritable, any type of, again, stressful situation, for example, like going through breast cancer and breast cancer treatment, your body's been through a lot. These pelvic floor muscles can be a little overactive and tense and try to be protective. But if they're overactive and they're not very good at relaxing, that can lead to some potential pain with that initial penetration because they're not able to relax and open to allow that penetration. And so this is why pelvic floor and just general relaxation can be so helpful for you just to get started on this journey. So focusing on the sensation of dropping the pelvic floor, relaxing the pelvic floor, and you can even try this right now as you're watching. So you can sense, is your pelvic floor elevated and tight? And if it is, see if you can drop it and relax it a little bit more. You can do that throughout the day, definitely before sexual activity as well. And then we also know that general tension throughout the body can also contribute to an overactive pelvic floor. So relax your jaw, relax your shoulders, and relax your belly. That can help with the pelvic floor. Some other strategies for decreasing discomfort. Again, we're talking about now outside of the pelvis. So we talked about some of that fatigue. Maybe you have neuropathy in your hands and that's hard to support yourself or to touch you or your partner with. So some positioning considerations are find a position that feels good and comfortable and have some fun with it. So if you've typically always done the same position or a couple positions with your partner, this may mean that you have to get a little creative. There's a lot of different resources or little card games or couple games that are available to find and explore different positions, but finding what feels good and comfortable for you is going to be key. If you have fatigue, try positions that are more relaxing and supported. So I usually recommend lying on your side or having some pillows to support you so you're not having to support yourself so much. We talk about energy conservation a lot. If you have fatigue, sitting when you take a shower, splitting up your chores over the days. We can also use those strategies with sexual activity as well. You can consider the positions that allow you to control the depth of penetration. So maybe that means, you're on top controlling the rate of penetration or the speed. That could be your partner's behind you, so kind of a spooning position, and your glutes are almost acting like a bumper, not allowing deeper penetration. That's always helpful. And then you can also try extra pillows, wedges, so you can see the one here, or bolsters. Again, anything just to kind of help support yourself, especially if you have a swollen arm from lymphedema. Just having some support for that arm so you're not feeling like it's so heavy and causing some more discomfort can be really, really helpful. Some sexual aids and tools. So there's a lot of really great research that has looked at using vibration. I like to call it vibration therapy, and also clitoral stimulators, which are the ones here on the left. This is just one brand that I like to recommend. It's called Lilo. You can see these look a little different than typical vibrators that you might think of. But the goal of these is to help with stimulating the external structures and supporting getting more blood flow into this area, and helping with arousal as well. Again, there's a lot of research that has looked at external stimulation, clitoral stimulators, and low vibration, so the lower setting, and helping that with arousal and blood flow, especially after menopause. In the middle there, we have two products. The first one is the Kiwi. So that's this one right here. So what's great about this is, especially if you're having pain with initial penetration and you're nervous about restarting penetration, this only goes in so far. And so you don't have to worry about something going in very deep. It's really soft silicone. And then if you're looking to do something more external, this has a broad base, and this can be used externally as well. So we can see here with the model, and it's just going to be stimulating the external part, or you can even use it this way to, again, bring more blood flow into that area and help with some of that moisture and just that sensation as well. The O-Nut there is from the same company. I absolutely adore these. I think this is one of the best products ever. So you can see it's super duper stretchy, and it comes with 4 rings. I usually recommend for people to start with 3, and then you can add or remove them if you need to. But these are going to be really helpful for people who have pain with deeper penetration. So ideally, we would work on whatever's causing that pain. But if that's because of a lot of atrophy or from pelvic radiation or something like that, the O-Nut's really helpful because it's going to act like a barrier so that your partner's not able to penetrate as deep, and you don't have to worry about who's controlling the speed or who's controlling the penetration. So the O-Nut's really helpful for that. And then finally, on the right-hand side, again, is pelvic therapists with getting referrals for pain with breast cancer treatment. These dilators are really helpful. So there's just graduated sizes. They can be a soft, flexible silicone like the ones here, or a hard plastic that you can see on the bottom. But because they're graduated sizes, these are really helpful for people who have that pain with initial penetration. We're just starting to get more flexibility with those tissues. We would be using these with the lubricant and the moisturizers on the off days. But these can be really helpful, again, especially if you're having pain with that initial penetration or deeper penetration as well. Pelvic health rehab. So just briefly on this. So pelvic health PTs and OTs have additional specialized training in addressing anything, we kind of joke, below the belt. So anything in this area, and doing external and internal assessments and treatments. So after your initial exam, your therapist will give you an individualized program. So they might recommend the dilators or pelvic floor exercises or stretches. So if we go to the next slide, then we can see what to expect in pelvic PT. So we're going to go through a thorough review of your cancer and your cancer treatment, your medical surgical history, and of course your symptoms. And that means the nitty gritty. We've heard it all. I promise there is no such thing as TMI. The more you can tell us about your symptoms, the more we can help you. If you prefer anal play, if you prefer vaginal play, if you prefer no penetration at all, more than one partner. We need to know that because we can help you reach what your goals are. So we want to know what your symptoms are, what makes them better or worse. Did you have these symptoms before you went through breast cancer treatment and now they're a lot worse after you've gone through treatment? And then finally, again, what are your goals? Because we are here for you and we want to help you return to what does sex look like for you? And especially kind of redefining what that might look like after breast cancer treatment. So, what does the exam look like? So we do look at first kind of your full body. So especially with breast cancer survivors, we want to look at your entire posture, how you hold yourself, your range of motion through your spine and your hips, your shoulders, flexibility and your strength, sensation. And again, all of these are going to be not just based on your treatment, but also, again, what are your goals and how can we assess these and help you address those? And then if you go to the next part, Amanda, we have then what to expect with the pelvic exam. So a lot of people are nervous for the pelvic exam. It's you are in control. So we will make recommendations based on your symptoms and what your goals are, but it's always up to you with what you're comfortable doing. So we're first going to start with an assessment of those external tissues, of these pelvic floor muscles, what's the pliability and the flexibility of those pelvic floor muscles. And then we're going to then do an internal assessment that you can see here in the picture. So we're assessing all of those muscles, your sensation, how well can you contract, relax, and push out. All of that's going to have an impact on your sexual function and your symptoms as well. And then finally here, wrapping up, trying to stay on time. It's so hard because I could talk about this for hours, but we have communication here. So how to bring this up to your medical provider. So if you know that you've been dealing with sexual dysfunction, but you haven't really brought it up, maybe you've marked it on that distress thermometer at the doctor's office, but no one's really talked about it with you. These are some ways and just some little tips of bringing it up. So depending where you're at in your treatment, especially if you're early on, you can ask how your treatment may impact your sexual health. Let them know that you're experiencing changes in your sexual health since your treatment. Bring it up during symptom check-ins. We always ask about the hot flashes and fatigue, and lymphedema, but your sexual health and these side effects are just as important as all those other side effects. You can also, I find it helpful to actually write out what your questions are, your concerns are, especially if you feel awkward bringing it up or nervous or weird or, you're not sure about bringing it up. You can always just have it already written up with you or have someone with you to help you bring it up so that you have kind of some support there. And then you can always ask directly for a referral for a pelvic health therapist or even a sex therapist as well. And then finally here, we've got communicating with your partners. So being open with them is going to be really important. So talk about the difficulties that you're having and you can always relate it back to your treatment, especially, again, if you're not super comfortable talking about your sexual health, you can let them know, hey, I had this radiation therapy. It's caused a lot of fibrosis and swelling in my breast. It's just really uncomfortable. Maybe we could try a different area for a little bit. I'm working on this in PT. But for right now, let's explore some other areas. You can talk about how they can help you and support you. So again, maybe we choose some fun pillows or fun bolsters or something fun to help with supporting you. And then just suggestions for ways to make everything more comfortable for you. And then finally, just some tips to get back intimacy is exploring your body. It is different after breast cancer treatment. Every year that we get older, our bodies get different and they change. And so start by just exploring your body in a non-judgmental way, almost like a mindfulness practice, and just exploring what feels good, what doesn't feel good, what feels nice that you want to spend some extra time on in sexual play. Start small. So, we went through all these bolsters and pillows and relaxing your pelvic floor and the kiwi and the vibration. Start with just one thing first. Start with just relaxing the pelvic floor. Find things you enjoy doing together. So again, maybe that's sitting together on the couch, watching a movie or playing a board game, finding ways to just be intimate together that are maybe not so sexual to get you more comfortable and start to talk about these things. I have Schedule It because we are all very busy. So many people schedule their sexual play, and that is a-okay. Put it on your calendar with a little winky face, and that's your time that you can get excited for. Start to build up some of that desire for your partner. Say it in a text. So again, we want to have some fun with it. We want to start to build some of that desire and arousal, and then just have fun with it. So happy to answer questions with Wendy here. Again, this was just trying to hit the main points that I wanted you to just start thinking about in this quick 30 minutes. But thank you again, Amanda, so much for having me on.
Thank you so much, Alex. That was incredibly informative, and I always learn something new, which is super fun for me as well. So just a friendly reminder, the Q&A section will be recorded, but that recording will be removed from the YouTube video, from the video that's saved on our website, just to protect your privacy and your information.
And as we wait for some questions to come in, can I talk about sex therapy really quick?
Of course.
Because I briefly mentioned it, but sex therapy is just a specialized mental health therapist that has additional training in sexual health. So it's hands off. A lot of people kind of get freaked out with like sex therapy, but it's just like you would go in and talk with a counselor. But again, they're just more specially trained in sexual health. And so again, especially if you have like kind of a mental block with getting back to sexual health, or you don't know how to talk about it with your partner, or how to start that first step of getting intimate with them, working with a sex therapist can be really, really helpful. I've worked with a lot of people that are working with a sex therapist while also working with physical therapy, and it's a total game changer.
I would love to add something myself, if it's okay. And I think the reason that nobody's asking questions is because this is the hardest thing we ever try to talk about. I was married for 40 years and there were still things I couldn't say to my husband, if you can believe that. And I wrote 2 books about it. So our sexuality is the most mysterious part of who we are. And cancer treatment is a huge disruptor. And so, just second to talking about how much money you have, that's how hard it is to talk about sex with anybody. And so I just want to add 2 things to like your huge plethora of information. One is that, we believe that our sexual life starts with desire. That's where you showed that ramp. But honestly, a really nice workaround is that you can start with arousal, and you can actually open your mechanism of arousal through your nose. So our arousal mechanism is actually in our limbic brain, and that is co-located with our olfactory system. And so when you find something that really a scent that turns you on, right? Like you can bring that, and that's how I started my business, honestly, was with love oils. So I can guarantee you that it works. So you don't have to wait to like want to have sex. You can wake up your arousal mechanism in your brain, which can sort of bring you quietly around to the idea, oh, that's right, I like to be touched. But honestly, after really invasive, terrible cancer treatment, where your body's in a lot of pain and you don't even recognize yourself, I would say that one place to start is just like touch. How does it feel to have someone put their hands on you? Forget about orgasm, forget about like anything further down the line, but just what kind of touch feels good to you. And you take turns with your partner so that you just kind of familiarize yourself with the language of the body. And that can take time just to do that. So, like a lot of the stuff you said is really great, but it might take somebody who's on this call months to get to that moment. So these are a couple easy things that you can start with, where you just start to become curious about what might feel good on my body again. What scent wakes up something in my head? Because for women, honestly, our arousal mechanism is not in our genitals. It's really in our head more. So, I can't help but add these things, having written a couple books about it, and knowing that many women with or without cancer don't know these things. And so you can really go slow and be gentle with yourself.
Thank you, Wendy. That
Mhm.
was, yeah, incredibly affirming. So I thank you for that. So I just want to wrap up again by just thanking Good Clean Love, thanking you, Wendy, for being here and for providing the community with so much information. Um, Good Clean Love has kindly provided our community with a 20% discount code. So I will drop it in the chat now. It'll also be in the email follow-up that I send you. So thank you again. A huge thank you to you, Alex. That was incredibly informative as always. I mean, like you mentioned at the beginning of this talk, sex after breast cancer, during breast cancer is not talked about. It is like so many of the other side effects that are not talked about. This one is really not talked about. And so I'm so happy that you agreed to do this webinar with us this evening, because it is something that we need to talk about more and really support the community about. So I cannot thank you enough. Thank you, everyone who joined us this evening. If you want to learn more about what it is that we do at Well Beyond Breast Cancer, if you want to connect with Wendy, if you want to connect with Alex, please do not hesitate to reach out to all of us. We are always super open to connecting with people and just making sure that they're informed about what it is that they're going through and what their choices are. So please do not hesitate to reach out to the three of us. Well Beyond Breast Cancer's contact information is all on the slide. And we are happy to share Wendy's email address, as well as Alex's. Definitely go follow both of their social pages. Like I mentioned, they both do incredible work with just providing education to the community. So thank you all.
Thanks for having me, Amanda.
Yes, thank you so much.
Yeah, nice to meet you, Alex.
Yes.
And good luck to all of you. Be kind to yourselves.
Yes.
Mhm.
Thank you, everyone.
Thanks.
Have a good
Mhm.
evening.